Over 300 pupils from Osborn High School in KwaBhaca in the Eastern Cape have been rushed to hospital due to suspected food poisoning. They suffered diarrhea and vomiting after allegedly eating items bought from informal traders. Let's discuss this now with Eastern Cape Health Department Spokesperson Sizwe Kupelo. Kupelo, good to have you, and thank you very much for coming on News at Prime this evening. Except for the commonality of diarrhea and vomiting, what else do these 300 people have in common in terms of what they consumed?
It was just that. In fact, we are looking at two possible sources, being water or foodborne. They were taken first to primary health care facility and then to the hospital. But the doctors worked very well, and they managed the cases, the majority of the cases, with only 4 learners that had to be admitted. But I can tell you now that they are also ready to go home because their situation has improved, their condition.
So water source or foodborne disease, what could have been the problem with the water source?
That would be determined once we receive the results of the samples that were taken. What we did was to conduct clinical investigation for the purpose of treating the patients who were in our facilities. But outside that or beyond that, the municipality together with the department had to work on the samples to take the samples to the laboratory because we need to establish the source of the illness.
So at this point, you are not sure what the source is, which to me says you are unable to then stop the source. Because if you don't know what the source is, kids are coming back to school tomorrow, they could still be drinking that source of water or eating whatever food that could be contaminated.
Unfortunately, we've got to work on the scientific evidence. So the prompt response to the problem was to treat the patients as they came to our facilities. Beyond treating them was to establish the source. And the only way of establishing the source is to send samples to laboratories so that we get an informed outcome, which is based on scientific evidence.
And when are you expecting to get results from the laboratories?
We are going to push for the results to be out this week, and that is done by the laboratory services. But our officials are working around the clock to ensure that we get to the bottom of the challenge that we're facing. In as far as the learners themselves, they remain in school at a hostel, and they are closely monitored by all stakeholders. We have taken an intergovernmental approach in dealing with the situation.
So what steps have been taken?
The step is the investigation.
Except for the investigation, I'm asking what steps have been taken to ensure that the learners who are at the hostel do not experience the same thing that they experienced on Friday.
There's a close monitoring around the handling of the food that they would be consuming over the weekend, and also ensuring that the water that they consume is properly checked.
And at this particular point, you're saying even the 4 that were in hospital would have been discharged, or at least are about to be discharged. What is the progress on the health of all the kids at this particular point? Are they holding up well?
Well, our doctors are very happy with their progress. They are actually moving up and down of the ward. They are far better than at the time they were admitted or they were received by the hospital. So I'm definitely sure that tomorrow a clinical decision would be taken to discharge those 4 learners. So
parents would say maybe a broader conversation at the school level, at the Department of Health level, is the ongoing monitoring of the environment in which food is produced and food is being given to children, that it is of an acceptable standard. What are the codes? What are the processes that are ensuring that those environments are always kept at the highest hygienic state that they need to be?
Well, that is vital, but that needs everyone, those who are responsible for such, to ensure that they do their job. Regular visits are done in such establishments. This is why we need to work closely with the health environmental services at the municipality level to ensure that they frequently visit those establishments to ensure that there's high compliance in as far as storage food is concerned, and as far as the quality of water. that is used by the community in that area.
Sizwe Kupelo, appreciate your time. Thanks so much for coming on.